Hello, I'm Dr. Savitri Gorakh. I'm a consulting diabetologist and a physician with an extensive experience in ICU. So, if we talk about Indian diet, we usually go for poha, upma, all of these things. So, if you're having poha, make sure there are lots of vegetables in it. Plus, you can have a protein source, say paneer or tofu or one bowl of dal, or you can take sprouts, moong, matki, you can make a bhel out of it and then you can have it along with your breakfast. The same thing goes for lunch too. So if you're having chapati, make sure that you avoid having another grain, that is rice. So you can choose between either chapati or rice for either of your meals. Secondly, make sure the protein content is high. So if you're having one bowl of dal, go for two bowls of dal. If you're having sabzi, you can include sprouts in it, or again, you can make something out of paneer, you can make something out of tofu, or you can include soya bean chunks and keema, all of these things. And the other thing that you have to make sure about is you're having a meal every 2 to 3 hours. If you end up having only 3 major meals, your appetite is going to skyrocket because there's going to be 5 to 6 hours of gap between those two meals, and you're going to have food which is more than necessary to your body. So if you're having breakfast at say 8 a.m., make sure you're having a mid-morning snack at 11 a.m. It could be one fruit, because when it comes for diabetics, rather than having fruit in the form of sweet dish after your meals, it's better to have it when you're empty stomach. See, suppose if you're having a meal, okay, your sugars are already on a higher side. Then you'll have fruits, which is very high in fructose. Your sugars are going to skyrocket. Now, take the other example. If you're having fruits in the middle, after 2 hours of having your first meal, your sugar spike is going to be very low. Then you have fruit in between, and your sugar spiking is not going to be that much. So, if you want to have fruits, have it between two of your meals when you're on empty stomach. Then the same thing goes for an evening snack also. So try to avoid having 5 to 6 hours of gap between your meals, and every 2 to 3 hours you can have any kind of healthy snacks, say nuts, you can have dry fruits, you can have makhana, you could have murmure, you can have roasted chana. The options are a lot. It only matters if it is very rich in carbohydrates or no. Go for more of protein source, go for more of natural sources. This is going to help you out a lot. Now, for when it comes to diabetes, what are some of the side effects that we see on a long term? So there are 3 things that you need to have some focus on. The first thing being neuropathy, the second thing being nephropathy, and third thing being retinopathy. So retinopathy is something which will affect your eyes. Neuropathy is going to be something which affects your nerves, and nephropathy is something which is going to affect your kidneys. So make sure you're having at least once a year some of the other tests to check these things out. You can go for a vision test, you can go for your kidney function test, and nerves, you have to make sure you're piling on your vitamins and minerals. Other thing, have to have 3 to 4 liters of water every day. I know it's a lot, but it's better to fill in bottles and have say 2 to 3 bottles every day, because your body will need hydration after whatever is going on outside. Also, you could be dehydrated, you could be low on water, which later leads to water retention and kidney problems. So have plenty of water. And thirdly, if you're a diabetic, make sure you're checking your feet every day, the lower part of your feet and the area between your toes. So you have to look out for any wounds at the sole of your feet and between your toes, because wounds for diabetics takes a long time to heal. So these are some of the general precautions that you should take as a diabetic person. It's a metabolic disorder, so it obviously gets affected due to stress and sleep cycles too. So a very high level of stress and incomplete sleep, even this is going to lead to much fluctuations of glucose levels in your body. So make sure you're sleeping properly and make sure your stress levels are on the lower side. So if you want to know more about diabetes or are suffering from diabetes, you can book an appointment with me via the YORE Care app.